Okay, let's unpack this. We're doing a deep dive today into something, well, a lot of people ask about. Does taking coenzyme Q10, Q10 actually help with fertility? Or maybe prevent early miscarriage?
It's a really common question.
Yeah, and our mission here is to look at the actual research, maybe challenge a popular idea, and honestly, just practice thinking critically about supplements,
Mm,
especially in reproductive health.
absolutely. And this topic, it's a perfect example of like a compelling theory versus the hard clinical proof. The basic claim, the reason it's so popular, really boils down to age and energy.
Okay, tell us a bit more about that theory because, I mean, it sounds pretty logical on the face of it.
It does, doesn't it? So as we age, especially after 30, our reproductive function generally declines. And this decline lines up with lower levels of Q10 in the body and also less mitochondrial activity.
Mitochondria is the cell's powerhouses, right?
Exactly. And making good quality eggs takes a huge amount of energy. So the theory goes, if you boost Q10, you boost the energy supply, maybe improve ovarian function.
Which could lead to better pregnancy chances and ultimately more live births. Makes sense theoretically.
It does. And what's really fascinating when you dig into the academic side is this contrast between potential and actual proof. Like there's a recent paper, 2025, I think, highlighting Q10's huge potential.
Huge potential. I hear a butt coming.
Yeah, there's always a but. The paper praised its role as a natural antioxidant and energy regulator in the ovary. All good things.
Okay, so where's the catch? That huge potential.
Right. The catch is that potential, it's almost entirely based on studies in cell cultures or in animal models.
So lab dishes and mice, not necessarily people.
Precisely. The paper itself, the same one praising the potential, it flagged many research gaps, big ones. Basically, it might work great in a petri dish, but getting enough Q10 to the actual egg inside the human body in a way that works, that's proving, well, really difficult.
Okay, so the lab story is promising, but the human story,
Yeah.
what does that look like? Let's zero in on the clinical trials.
Yeah, and that's where things look quite different. If you look at the published human studies, there's really only one major trial we could find from 2017. It looked specifically at Q10 for conception in women over 35.
And the result?
The conclusion was pretty clear. Q10 had no significant effect. Not on ovulation response, not on pregnancy rates overall.
No significant effect. That's pretty definitive from the main trial we have.
It is, and that lack of strong evidence, especially the absence of large, well-designed randomized controlled trials or RCTs.
That's why the big medical bodies, like the obstetric societies,
Yeah.
don't actually recommend it.
Exactly. There's no official guidance saying take Q10 for fertility. The evidence just isn't strong enough. Plus, you have to remember, miscarriage. It has so many different causes.
Right, chromosomal issues, hormonal problems, immune factors.
Yeah, a whole range. Q10, even if it worked perfectly for its theoretical role, which is mainly about mitochondrial function or maybe oxidative stress, it could only possibly address a really small slice of those causes. It wouldn't fix the major drivers like, say, chromosomal abnormalities, which account for a lot of early losses.
So even in the best case scenario for Q10, its overall impact would likely be small.
Probably minimal, yeah.
Okay, so this brings us to that critical thinking point. If the human data is so weak or even negative, why might a doctor or clinic still suggest Q10?
That's a great question. Academic commentaries sometimes point to a few non-medical reasons. One, maybe less common but needs mentioning, is the financial side selling supplements.
Okay, setting that aside though.
Right. Another possibility is just, well, error, or maybe misunderstanding the evidence, mistaking that potential shown in animal studies for proven human benefit.
I see. And there was a third reason mentioned sometimes, something about patient comfort.
Yes, and this one's maybe more common. It's the idea of showing diligence. You know, patients often feel anxious, they want to do something proactive.
Dang.
And if there aren't many proven medical options, a doctor might suggest Q10 partly to satisfy that need, to make the patient feel like action is being taken. It's more about managing the psychological aspect, perhaps, than a strong belief in the supplement itself.
That makes a certain kind of sense, even if the evidence isn't there. So for you listening, trying to navigate all this, what's the real focus?
Well, the evidence strongly suggests focusing away from a single supplement like Q10. The things that do have solid evidence backing them up, they're the holistic basics, like maintaining a balanced diet, getting regular exercise, making sure you get enough sleep, and finding ways to manage stress. Those are the cornerstones.
It's the foundations of health, really.
Exactly. And one more really important point for managing expectations and, frankly, anxiety. The data, for instance, from the Mayo Clinic is actually very encouraging. Most women who have an early miscarriage, they go on to have healthy pregnancies later.
That's crucial here.
It really is. Even for women who've sadly had 3 miscarriages, the chance of having a healthy baby next time is still high, something like 60 to 80%. And that's regardless of taking Q10 or not.
So the body's natural resilience is often underestimated,
Hugely.
which leads to maybe a final thought for everyone listening. The best evidence often points not to a magic pill, but to understanding our body's own strength. It makes you wonder, doesn't it? What other common health tips or supplements do we maybe accept without really demanding this level of solid clinical proof?